Welcome to the Vital Signpost. We always try to bring you the most clinically relevant information, and I think today's deep dive will definitely hit the mark. We're talking adrenal glands.
Small but mighty right.
Absolutely. As nurses, we know they're essential, but honestly, they can be a bit overlooked sometimes.
Yeah, definitely. I think most of us remember the fight or flight response and adrenaline.
Right. But there's so much more to these glands than just that. So much to consider in terms of patient care.
Exactly, like how they regulate our hormones,
Yeah.
our stress response, even our blood pressure and energy levels.
Seriously, they impact pretty much every system in the body.
So let's start with the basics. Each adrenal gland kind of sits on top of each kidney like a little cap.
Like a little hat.
Yeah, and each gland has two main parts, the cortex on the outside and the medulla on the inside.
And I think it's important to remember they're made up of different types of tissue and have totally different functions.
Right. The medulla is where those catecholamines come from, epinephrine, norepinephrine, all that fight or flight stuff.
Right, that's a whole other deep dive. But today we're focusing on the adrenal cortex.
Which is the real powerhouse when it comes to hormone production. It makes corticosteroids, which are absolutely vital.
Okay, so break it down for us. Corticosteroids, what exactly are they?
They're hormones. They're essential for life. And they regulate a ton of different bodily functions.
I've heard they're involved in everything from how we use energy to how we handle stress.
Exactly. They're key for metabolism, for our immune response, for regulating blood pressure. Really important stuff.
Like I said, small glands, big impact. So tell me more about these different types of corticosteroids.
Sure. The cortex produces two main types, glucocorticoids and mineralocorticoids.
Okay, let's start with glucocorticoids. I feel like those are the ones we hear about the most.
Probably because they're involved in so many different things. Cortisol's the big one, everyone knows.
Yeah, and we give it all the time in the hospital to reduce inflammation.
Exactly. And they also affect our metabolism, like how our bodies use carbohydrates, fats, and proteins.
So they're not just about inflammation.
No, they're not. They also play a role in suppressing the immune system, which can be super useful for certain conditions.
And then we have mineralocorticoids. What's their main role?
Electrolyte balance. That's their specialty.
Which is huge, right? I mean, electrolytes are vital for so many things.
Absolutely. They regulate the levels of sodium and potassium in our bodies, and that affects fluid balance, blood pressure, even the pH of our blood.
So many things rely on the right balance of electrolytes.
Definitely. And that's where mineralocorticoids like aldosterone come in. They make sure everything is running smoothly.
It's like they're the conductors of our internal orchestra.
Great analogy. They're constantly fine-tuning everything to make sure our cells have what they need to function.
This is also fascinating, but it also seems really complex.
It is, especially when you consider how the production of these corticosteroids is actually controlled.
Right, because our bodies don't just randomly pump out these hormones. There's a system in place, right?
Exactly. It's all regulated by a feedback loop. And it involves several different organs.
Sounds complicated.
It's actually pretty elegant when you break it down. Think of it like a thermostat.
Okay, I'm listening.
So the hypothalamus, a part of the brain, acts like the thermostat. It senses the level of corticosteroids in the blood.
And if the levels are too low?
It sends a signal to the pituitary gland, which is also in the brain.
Okay, and what does the pituitary gland do?
It releases a hormone called adrenocorticotropic hormone, or ACTH.
An ACTH is basically like a messenger.
Exactly. It travels to the adrenal cortex and says, hey, we need more corticosteroids.
So the adrenal cortex gets the message and ramps up production.
Yep. And as the corticosteroid levels rise, the hypothalamus senses that and tells the pituitary to slow down ACTH production.
It's like a constant balancing act.
It is, and it's all about making sure our bodies have just the right amount of corticosteroids circulating at any given time.
So what happens when this delicate balance gets thrown off? I'm guessing that's when we start seeing problems.
You got it. When corticosteroid production is either too high or too low, it can lead to a whole host of issues.
And I know there are specific conditions associated with these imbalances, right?
There are, and two of the most important ones are Cushing syndrome and Addison's disease.
I've heard of Cushing syndrome. It has some pretty distinctive symptoms.
It does. It happens when there's too much cortisol in the body, and it can cause some pretty dramatic physical changes.
Like that moon face I've seen in textbooks.
Exactly. And a buffalo hump on the back. It's all caused by fat redistribution.
And it's not just about how it looks. I imagine it affects people's health, too.
Oh, absolutely. It can lead to high blood pressure, muscle weakness, easy bruising, even problems with wound healing.
So what causes Cushing syndrome in the first place?
It can be a few things. Sometimes it's a tumor in the pituitary gland. Other times it's a tumor in the adrenal gland itself.
So the tumors are basically causing the glands to overproduce cortisol.
Exactly. And sometimes it's not a tumor, but a condition called adrenal hyperplasia, where the adrenal glands are just overactive.
And I know prolonged use of certain medications can also cause it, right?
Yes, like prednisone. If we don't taper those medications carefully, they can throw off the body's natural hormone balance.
So important to remember that as nurses. Even though these medications are really helpful, they can have some serious side effects.
Absolutely. We need to be aware of the risks and benefits and make sure we're using them appropriately.
Okay, so we've talked about what happens when there's too much cortisol. What about when there's not enough?
That's where Addison's disease comes in. It's essentially the opposite of Cushing's.
So with Addison's, the adrenal glands aren't producing enough cortisol.
Exactly, and that can lead to a whole different set of problems.
Like what?
Well, the biggest one is fatigue, like extreme fatigue. People with Addison's often feel completely wiped out all the time.
And I've heard they can have problems with their blood pressure and electrolytes too.
That's right. Low blood pressure is common. And they can have low sodium and high potassium levels, which can be dangerous.
So those are definitely things we need to be monitoring closely in our patients.
Absolutely. We need to recognize the signs and symptoms early and make sure they're getting the treatment they need.
So we've covered a lot of ground already. We've
Right.
talked about the anatomy of the adrenal glands, the different types of corticosteroids they produce, and even some of the conditions that can occur when those hormones are out of balance.
And I think this is just the tip of the iceberg.
Definitely. There's so much more to learn about the adrenal glands and how they affect our patients' health.
Well, stay tuned because we're going to dive even deeper into the pharmacological side of things.
Exactly. We'll be back after a short break to discuss the medications used to manage these conditions and what nurses need to know about them.
So now we're talking medications, how we actually manage these adrenal gland disorders we've been discussing.
Right. Because it's one thing to understand the physiology, but we need to know how to apply that knowledge in practice.
Exactly. And thankfully, we have a whole arsenal of medications that can help.
Let's start with glucocorticoids. Those seem to be used for a wide range of conditions.
Oh, they are. They're incredibly versatile. We use them for inflammation, for immune suppression.
I've seen them used for everything from asthma to arthritis.
Exactly. And they come in all sorts of forms, too. We have topical creams, inhalers, nasal sprays, oral tablets, injectable solutions.
So many different ways to administer them.
Right.
How do we decide which route to use?
It really depends on the specific condition and the desired effect. Sometimes we need a localized effect. Other times we need something systemic.
Makes sense. But I know these medications can have some pretty serious side effects.
Yeah.
What are some of the things we need to watch out for?
Well, one of the most common ones is hyperglycemia. Glucocorticoids can raise blood sugar levels.
Especially in patients who are already diabetic.
Right, so we need to monitor their blood sugar very carefully and adjust their insulin or other diabetic medications as needed.
So regular blood glucose checks are essential. What else should we be keeping an eye on?
Blood pressure. Glucocorticoids can also cause fluid retention, and that can lead to hypertension.
So we need to watch for any signs of swelling or edema too.
Absolutely. And we need to make sure their electrolytes are in balance because glucocorticoids can affect those too.
It's like we're constantly juggling all these different factors when we're managing patients on these medications.
It is. We need to be thinking holistically, looking at the whole picture.
And we haven't even talked about the psychological effects yet.
Oh, yeah. Glucocorticoids can definitely affect mood and behavior. Some people get irritable or anxious. Some have trouble sleeping.
So we need to be aware of those possibilities and talk to our patients about them. Make sure they feel comfortable reporting any changes.
Absolutely. And then there's the whole issue of immune suppression.
Right, because glucocorticoids can weaken the immune system.
Exactly. So patients are more susceptible to infections, and the infections might not present in the typical way.
So we really need to be vigilant. Even a low-grade fever could be significant in a patient on glucocorticoids.
It could. So we need to teach our patients about the signs and symptoms of infection and encourage them to report anything unusual.
And we need to be extra careful with infection control measures.
Absolutely. Hand hygiene is paramount, and we need to make sure they're up to date on their vaccinations.
Speaking of vaccinations, I know there are some specific interactions we need to be aware of when it comes to glucocorticoids.
Oh, yeah, there are a lot of drug interactions to consider. Glucocorticoids can interact with NSAIDs, diuretics, anti-diabetic drugs.
It seems like we need a pharmacology degree just to manage these patients safely.
It's definitely a lot to keep track of, but that's why it's so important to have a good understanding of the medications and how they work.
And to always be checking for potential interactions before we give any new medication.
Right, and to educate our patients about the potential risks and benefits.
And let's not forget about the importance of tapering these medications gradually,
Oh yeah, that's crucial. We can't just stop them abruptly, especially if the patient has been on them for a long time.
because that can cause the adrenal glands to stop working properly.
Exactly. So we need to taper them slowly to allow the adrenal glands to recover and start producing their own hormones again.
So much to consider with glucocorticoids. What about mineralocorticoids? Are there similar concerns with those?
Some, but not as many. The main mineralocorticoid we use is fludrocortisone.
And that's primarily for Addison's disease, right?
Right. It helps to replace the aldosterone that's missing.
So it helps to regulate sodium and potassium levels.
Exactly. And that's essential for maintaining fluid balance, blood pressure, and a normal heart rhythm.
I've heard it can also be used for certain types of hypotension.
That's right. But the main indication is definitely Addison's disease.
Okay, so what are the nursing considerations for fludrocortisone? What do we need to be watching for?
Well, like with glucocorticoids, we need to monitor blood pressure and electrolytes very carefully.
Because it can cause hypertension and hypokalemia?
Exactly. And there are also some drug interactions to be aware of.
Like what?
It can interact with NSAIDs, certain antibiotics, even some herbal supplements.
So again, it's really important to get a thorough medication history and check for potential interactions before we give any new drug.
It all comes down to patient safety. We need to make sure we're doing everything we can to minimize the risks and maximize the benefits of these medications.
It sounds like managing patients on corticosteroids requires a lot of knowledge, attention to detail, and good communication.
It does. But I think it's also incredibly rewarding to see how these medications can improve our patients' lives.
I agree. It's all about using these powerful tools wisely and compassionately. Okay, so we've covered the medications themselves, but let's talk about the bigger picture. What does all this mean for us as nurses?
Well, I think the biggest takeaway is that managing patients on corticosteroids requires a really holistic approach.
We need to be thinking about all the potential effects these medications can have.
Exactly. And that means careful monitoring, thorough patient education, and really good communication with the entire healthcare team.
Let's start with monitoring. What are the key things we need to be keeping a close eye on?
Blood glucose is a big one, especially for patients on glucocorticoids.
Like we talked about, they can really raise blood sugar levels.
Right, so we need to be checking blood glucose regularly and be prepared to adjust their diabetic medications if necessary.
And we can't forget about blood pressure.
Oh, definitely. Corticosteroids can cause fluid retention, which can lead to hypertension.
So we're monitoring blood pressure, watching for any signs of edema.
Exactly. And we're also keeping an eye on their electrolytes, making sure their sodium and potassium levels are balanced.
It's like we're constantly assessing and reassessing, looking for any subtle changes.
We are, because sometimes the side effects of these medications can be sneaky.
Like those mood changes we mentioned earlier.
Right. We need to be paying attention to our patients' behavior. Are they more irritable, more anxious, having trouble sleeping?
And we need to make sure they feel comfortable telling us about any changes they're experiencing.
Because they might not even realize those changes are related to the medication.
And then, of course, there's the risk of infection.
Always a concern with corticosteroids, especially the higher doses or long-term use.
Because they suppress the immune system.
Right. So patients might not have the typical signs and symptoms of infection. They might not even get a fever.
So we need to be super vigilant, looking for any subtle signs.
And we need to educate our patients about those signs, teach them what to watch out for.
And encourage them to report any changes no matter how small they seem.
Exactly. Early detection is key, and it could really make a difference in preventing serious complications.
So much to consider with the monitoring aspect. But patient education is equally important, right?
Oh, absolutely. We need to empower our patients to be active participants in their care.
And a big part of that is making sure they understand their medications.
Right. We need to explain how the medications work, why they're taking them, what the potential side effects are.
And I think it's important to emphasize that they should never stop taking these medications abruptly.
Oh, yeah, that's crucial. Sudden withdrawal can be really dangerous.
It can throw their whole system out of whack.
Exactly. So we need to make sure they understand the importance of tapering the dose gradually.
And to always consult with their healthcare provider before making any changes to their medication regimen.
And I always encourage my patients to carry a medical alert card or wear a bracelet.
That's a good idea, That way, in an emergency situation, healthcare providers will know they're on corticosteroids.
Right. It could be life-saving.
We've covered a lot of ground in this deep dive, from the anatomy and physiology of the adrenal glands to the complexities of corticosteroid therapy.
And it's clear that these tiny glands play a huge role in our patients' health.
And as nurses, we have a critical role in managing those patients.
We do. We need to stay informed. We need to be vigilant. And we need to advocate for our patients every step of the way.
Well said. And to all of our listeners out there, thank you for joining us on this journey. We hope you found it informative and helpful for your nursing practice. Keep learning, keep asking questions, and keep making a difference in the lives of your patients.